Today, the focus is on local authorities at every level, examining how we might, or perhaps should, do things differently to respond to personalisation and to meet the expectations and aspirations of this policy. A policy shift which is supported across all political parties. We're also considering the implications for the culture within our organisations and, of course, our workforce, who sit at the very heart of all that we do.
What do I mean when I say strategic approach? Well, what the Audit Commission have defined that as meaning is a combination of all these things. What we're trying to suggest is that for local authorities and partners to have a strategic approach towards older people's service delivery, they need to have incorporated a real understanding and engagement with the older people's community. Events such as this are part of that approach. They will have age-proofed mainstream services, so they will be services available across the population, regardless of age or any other criteria at all. There will be some specific services around promoting independence, and then, of course, there will be high-level dependency social care services. What we've also tried to highlight there is where the higher level costs come in. So social care is where the high cost would be. At the top, understanding and engagement with the community is likely to be low or nil cost. So it's a combination of all of those factors that local authorities need to adopt to have what we're calling a strategic approach. So really, at that second level, again, which is limited or lower cost for local authorities in our view. It's about improving access. It's talking about services to improve independence. And it's about enabling people to keep that independence for as long as possible. And very much about designing and delivering services with older people in mind.
People who go there to retire, if you like, the older population, are people who in many ways make a dynamic and important contribution to those rural areas. The population in rural areas is growing every year older by 3 months, which doesn't sound very much when you think about it. But if you begin to aggregate it up, then you begin to realise that there is a huge ageing population in rural areas, and therefore there are people who are bound to have particular needs. They will become less independent and more dependent. If we're going to provide services in rural areas, they're going to cost, and money is required.
Now, physiologically, there's a lot of research showing it does affect the brain. It affects physiologically our stress levels as well. And a big study in the BMJ from an MRC unit in Strathclyde showed that where you had greenery and you accounted for all the social advantages of where people live in green leafy suburbs compared to non-leafy suburbs, when you accounted for all of that across Europe, where there was green in poor areas, there was less obesity and higher rates of physical activity. So I would suggest to this Commission that we are trying to build resilience and allow people to make their own decisions. And I think we should use all parts of the Council and the County Council to create this natural health service, where it's not the NHS. We do have access to green space. We do have areas where patients don't have to go to a gym or to a swimming pool to get their exercise, but they actually feel safe to do it in their streets where there's greenery, as evidence has suggested. And we look at green space as a health resource. So perhaps a health impact assessment is what's needed when it's removed. And the environmental injustice, where the poorest live in deprived green space areas and the rich live in leafy suburbs, is purely of our own making, and it's something we can also deal with. Thank you.
Connected care is about integrating health, housing and social care in the most deprived communities. Very much done with the community, not to it. The IPPR report talked about people having a breadth and depth of needs. So someone may have a depth of needs around substance misuse, mental health and learning disability, and a breadth of needs around employment, debt, housing, the combination giving rise to complex needs. But of course people can have a whole range of breadth of needs that are not met, they don't meet the criteria for support and still fall between the gaps of services. Connected care is participative, it is deliberative, it is intense, it's hard, but it's really engaging with the community. And when I say the community, it's a whole community organised on an estate or ward basis. So we reach the whole community, including those hard-to-reach groups who are rarely consulted and who are often marginalised. And connected care has been quoted in a lot of government documents. And on one case, that's easy. It really is about influencing and informing the design and delivery of services at a local level. And so commissioners will need to do this. They'll be judged on that in terms of demonstrating how communities are at the centre of commissioning, particularly as we move to a more joined-up approach to health and social care, whatever the flavour of government. And I think there's a bigger role for the voluntary sector.